How do you identify if it is a rash which is important for you to seek help, or it's a rash which you can take care at home? So hi, I'm Dr. Tina Ramachandran. I'm a dermatologist with a special interest in dermatosurgery, lasers and medical cosmetology. And I practice in Sakarnagar in Bangalore. So what is a skin rash? A skin rash is a reddish discoloration on the skin where the skin is also itchy, it probably burns, and it is something which is giving signs of inflammation. So it's warm to touch, and this is something which gives a lot of discomfort to the patient. Like you cannot sit with a rash comfortably if it is a severe one. So the common ways in which we get rashes could be allergy, like a change of weather, etc. It can be infections, which is bacterial fungal organisms, or it can be some sort of irritants. It can be some form of irritants, like you've come across some strong cosmetic which you have used and it irritated your skin. It can also be environmental factors like sun exposure, cold exposure, etc. So let's discuss 4 different types of skin rashes. One is contact dermatitis, next is psoriasis, third is eczema, and then a fungal rash. So contact dermatitis rash is when you have come in contact with something which was very strong for your body and it caused a red sort of a uncomfortable sensation of burning, itching, and then it is left a lot of reddish sort of a textured rash. Now this is usually located in the area of contact. It doesn't spread all over the body unless it is an allergic sort of contact, and it has that sort of an allergic contact has a delayed sort of a response. But when you have an immediate response, the rash is confined to that area. So in contact dermatitis, you have an immediate contact, irritant contact dermatitis, which happens only in the area where you are exposed, or you have an allergic form in which it can be all through the body, or it can be a delayed response. So in this, you have a sensation of burning, itching and redness, and over a period of time, this gets worse. And when it usually is a contact dermatitis, it's confined to the area that you are in contact with. Like you used a new facial, you had a new cosmetic cream and you have the rash only in those areas. Or you came in contact with some sort of a change of pollen allergy and you have rashes in the exposed areas. Or you have rashes all over the fold area where you were out in a dusty environment. So the treatment for this should be calming the skin down with calamine or ice, and then if still it doesn't respond, using antihistamines which are cetirizine or atarax. So cetirizine can be used as oral tablet, and still if it is not reducing, it's time that you have to show it to the doctor. Now the next type of common infections that you see which look like a rash is the psoriasis rash. So in a psoriasis rash, you have a dry patch, and if you scratch it, it's very powdery and it falls all over the place. Now this kind of a rash can appear anywhere. It can be on your hands, on your legs, it can be on your scalp. The classical feature of this is when you touch it, it's all powdery and it's quite itchy, and sometimes it can also bleed or be watery. And these rashes are something which can only be controlled, it cannot be cured. So when you see a rash which is very atypical and something you have never witnessed before, it's time that you visit a doctor to understand why this is happening. The areas is a clue, like it can happen on the scalp, on the elbows, the knees, the palms and the soles commonly, or generally it can appear at any part of the body. The next type of a rash we can discuss is eczemas. Now eczemas is very common thing and it happens as a allergic sort of a reaction pattern on the skin, and it happens across age groups. So when you have the eczema, it can be an acute one, meaning very recent, very red, very itchy, weeping, watery sort of a thing, or it can be a dry eczema, like it is there for very long. You have cuts and deep wounds and quite troublesome that you cannot do your daily routine. So eczemas have a tendency to recur, and people have a long-term sort of a self-care which they have to do, and this definitely needs support. And the final rash that we're going to discuss today is a fungal rash. Now the fungal infection is in epidemic proportions. There are people who have fungal infections for years together, and if they've not taken care, it spreads to everybody in the family. It's quite annoying to have, and it's resistant to treatment. So basic care should always be local care, as in How are you preventing the spread of it in families? By not sharing the clothes, washing the clothes separately, having a good ventilation inside the house, and the fungal spores usually spread amongst people. So having good hygiene, and also using the right creams and medications and not stopping it until the doctor informs you to stop it. And the doctor's job is also to guide you that this is done and how you have to maintain it further. Only if you do such things, you can get rid of fungal infections in these days. So what are the practical ways in which you can prevent a rash? One, you already know that you have a tendency for a rash in certain conditions like exposure to sun. You'll have to use your sunscreens. You have to make sure that you keep your skin well hydrated, sun protected. And if there is a rash, what are the first few steps you take? You can ice the place, then make the area calmer. You can use a bit of calamine, and you can also take a tablet or a syrup which has cetirizine to calm the skin down. The next step is to make sure that if it is not controlled and spreading, you have to reach out to your doctor. And if there is a fungal infection, general hygiene, such as not wearing wet clothes for long. If you gym, to make sure that you are immediately having your bath. Also, to not share clothes. These are some things practically that you can do to prevent it. And when there is psoriasis, stress management is very important. There are people who are overwhelmed with work or thinking as an addiction, not sleeping well. These are certain groups of people for whom psoriasis can persist and persist for very long. And it can become a social issue and lead to a lot of mental health imbalances. So you have to take care that you start with the basics so that you are able to control and curb this disease better. Eczemas are also very much seasonal, and I have personally seen people who have a lot of milk and wheat in their diet getting worse at eczemas. So you may want to reduce food groups such as these, and also sugars. And these go a long way in tiding over eczemas. Also making sure that you're using a lot of creams, which are barrier repair creams, hydrating it, and preventing wet work for long, using gloves in case you are in the kitchen for long. These are all few steps in which you can prevent these rashes. If you like this video, do hit the like button and subscribe to our channel.